Getting prior authorization for Ozempic through WellCare Medicare might seem straightforward on paper, but we all know the real challenges can appear in unexpected ways. Let's start with a typical scenario. Dr. Carter has a patient struggling with type 2 diabetes who has tried multiple treatments. Ozempic could finally be the answer. To avoid delays, Dr. Carter's team needs to gather all essential information: patient name, date of birth, and WellCare member ID. Simple, right? But one small typo or incomplete field can push the request back days. And for a patient managing their blood sugar, every day counts. Now let's talk about prescriber details. Dr. Carter's practice had to resubmit once because the NPI number wasn't entered. When WellCare can't verify the prescriber, it's an instant delay. With the correct physician's name, clinic address, and NPI, you're showing WellCare that this request is from a verified provider. It's a small detail, but it makes all the difference. Next, specifying the medication correctly. Ozempic at 1 mg in a 3 ml pen injector. This is where a lot of practices get tripped up, especially if they're adjusting dosage for specific needs. WellCare has strict guidelines, so if there's any change to dosage or frequency, extra documentation is essential. Let's say Dr. Carter's patient needs an adjusted dose. If the team doesn't explain why in the supporting documents, WellCare's reviewers might flag the request, leading to unnecessary back and forth. And then we get to the ICD code, 𝗬𝗓 for type 2 diabetes without complications. Using this code isn't just about filling a field, it tells WellCare that Ozempic is medically necessary for a documented condition. Imagine the frustration of an approval denial simply because a code was missed or entered incorrectly. Getting it right first saves time and helps patients get timely treatment. Now let's consider request types. For most patients, a standard review works, but if there's a real urgency, like a patient with rapidly changing blood sugar levels, an expedited review might be the best option. This feature can be life-changing for some patients, but it's often underutilized because teams are unsure when to apply it. Supporting documentation is where it all comes together. Dr. Carter's team has been burned by PA denials in the past, all because a lab report was missing, or a clinical note didn't clearly state why Ozempic was necessary. Submitting recent lab reports, clinical notes, and even records showing other treatments have been less effective can be the key to a smooth approval. As we say, document everything, no detail is too small. Finally, submitting the PA request through WellCare's electronic system. Here, every box, every form, and every attachment matters. Even one missing document can lead to a denial. Dr. Carter's team double-checks everything to avoid this because a denial means restarting the whole process. More paperwork, more time, and a frustrated patient. And those codes again, 𝗬𝗓 is the foundation. It aligns with WellCare's requirements, making sure the medication's purpose is crystal clear to the reviewers. Without it, you're likely looking at a rejection. At this point, you might be thinking, this is a lot for one medication request. And it is. That's why Staffingly partners with healthcare providers like Dr. Carter, streamlining the entire prior authorization process. Our team knows the specifics of WellCare's requirements and takes on the heavy lifting from completing forms to attaching documentation, right down to confirming every code is right. By letting us handle these details, providers can focus on patient care, not paperwork. Imagine the time saved and the peace of mind knowing every request meets WellCare's standards. With Staffingly, you get more than just a service. You gain a partner who understands the importance of accuracy in prior authorizations. We're here to make sure your team gets approvals on the first try, sparing your patients the wait and freeing up your time to do what you do best, provide care. So as you prepare your next prior authorization, consider the impact that accuracy, documentation, and the right support can make. For PA support that's tailored to healthcare providers, reach out to Staffingly. We're here to help you streamline this process so you can focus on the health of your patients, not on navigating insurance approvals.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.